So we'll start with a couple of online Green Book changes. This isn't so new, this is from November 2012, but the risk of exposure to rabies virus has been changed from being a kind of one-size-fits-all approach to breaking people down into whether they're continuous, frequent or infrequent. Does anybody know what the continuous is? No? You do, because I told you on Tuesday. Lab workers, yes. So people who are at risk of handling the virus all the time. And then our bat handlers, people working with imported animals, go into the frequent risk groups. There is specific advice how you boost and when you do serology on those groups. But for the purpose of this presentation, we're thinking about travellers. So they've been put into the infrequent risk. So what that means is that we're not routinely offering boosters to travellers. So that's quite a change from what we've been doing before. So we still want to make sure travellers at risk are vaccinated, and if we're not vaccinating travellers, we still want to make sure they know and understand how to avoid rabies when they're travelling overseas, and what action to take if they're bitten, because that's often the mainstay of what they really need to be doing. That's rabies. And then the chapter in the online Green Book for Japanese encephalitis was totally rewritten in November 2013. And the situation now is that we have one vaccine, which is a licensed vaccine. So for those who've been doing travel for years, we've had unlicensed vaccines and different products available. And now when we have a licensed product, we shouldn't be using unlicensed products. So we have got Ixiaro now, and it's also got a reduced lower age limit from 2 months of age that we can use this vaccine from. Adults at continued risk are recommended to be boosted, but there's no data on boosting in children. And the advice is that the JCVI will update the online Green Book when data becomes available. We don't use that much Japanese encephalitis vaccine, and often it's specialist centres that are doing it. So hopefully they're up and aware of that information. So typhoid vaccine, that's been a real problem over the last couple of years. So we had the big recall with the vaccine that we had to not use, and then we've had supply issues with the injectable vaccines from both the manufacturers. There's an enteric fever report produced by PHE, and they looked at the reported cases of typhoid during part of this time period. And what do you think's happened to cases of typhoid? Nothing's changed. Yeah, you were at my study down Tuesday, weren't you? Yeah, nothing's changed, and you can see that data for yourself. Because what's our mainstay with preventing typhoid infection in travellers? Yeah, it's food and water hygiene. So it's giving those really strong messages and identifying people who are in increased risk groups. And that the groups that we see typically returning to the UK with typhoid or paratyphoid infection are people visiting friends and relatives in Pakistan and India and Bangladesh. So we really need to target our efforts, as well as it is indicated in other travellers. But we have got supply coming back online of the injectable vaccine. People have been using the oral vaccine as well. They're both licensed, so you can use whatever works best. But hopefully, as the supply comes back online, it eases some of the pressures that people have been feeling with this. What I wanted to flag to you is this is taken from Vaccine Update, which is the PHE produced vaccine supply and information monthly newsletter that comes out. And you can access that from the PHE immunisation pages. And when it's open, there's a link at the bottom of each page that you can click on, and then you can register to have it delivered directly to your email as it's published. And I would really recommend you do that. Is there anybody that doesn't do that currently? Or you all are doing that? So if you're not doing it, go away and do that, and then you can you'll see what's happening, because it's always updating us about supply issues or online Green Book changes. So it's a really nice way of staying up to date all the time. Right, the next slide. You know, on Have I Got News for You, where they put up 4 pictures and you've got to get... Yeah, let's see if anybody can get this. Yeah, so it's the World Cup. I was particularly excited to find a slide with monkeys in football. I thought that was brilliant. So this summer we have got the World Cup, and this is a map of all the stadia. And if I just now... I'm going to cover up the sad England fans, because I suspect that's what they will look like. But if if you look at this map, this is a map showing the areas at risk of infection for yellow fever. Our first match is in Manaus, if you're English. Sorry, I know there are people who will be supporting other teams, so this is slightly England-centric. So Manaus is the first one, so right smack bang in the red, and one of the second matches is in Belo Horizonte, which is also in the red area down here. If you're risk assessing travellers for yellow fever, particularly to Brazil, when you look on a website like NAFNAC, it doesn't go by city, it goes by state. So remember that you need to know which state Belo Horizonte is in order for you to actually map that back, because Brazil is massive, so the edge of that red line to the coast is actually quite enormous. So just to be mindful of that. But what's been the complication this year with yellow fever? Massive shortage. My colleagues at Sanofi have told me it's all back online, so supply should be restored. I was just going to flag to you that NAFNAC do have a countdown to the World Cup live on their website, but if you click on the link, there is a PHE leaflet specifically written for people travelling to the World Cup. I got some nurses on Tuesday to make their own versions, and they hadn't actually seen it, and they picked up on similar health issues that they were worried about with this group of individuals. But there have been other changes with yellow fever in the last year. In that May last year, the WHO Vaccine Advisory Group said that they felt a single dose was sufficient to confer lifelong immunity. So that was their advice, but as you all know, yellow fever vaccine is subject to the international health regulations, which state that a certificate is valid for 10 years. And none of our guidance in the UK on either the Green Book or NAFNAC has kind of moved to go into line with this statement from the WHO. I'm sure the JCVI are thinking about this or have looked at it. Minutes are due out next week, so we might learn something more then. That's our new chair of the JCVI. I forgot, I should have put that on my thing at the beginning of what's happened in the last year, but we'll get to that later. So, sorry, I don't feel I've been massively helpful with that, but that's kind of the situation with yellow fever. I like this illustration. It's taken from a paper looking at the international epidemiology of meningococcal disease. And Helen picked up on the fact that, we have got different strains that are prevalent in the UK, but our travellers will be exposed to different strains depending on where they're travelling. And the main area we vaccinate for is people going to the meningitis belt across sub-Saharan Africa, where you can see there's a great predominance of Group A, and then slightly less of W135, or to religious pilgrims going to Hajj and Umrah, where it's a certificate requirement. The thing that's most important for us at the moment about meningitis vaccines is that you use the right vaccine and that you record it. So there's 3 ACWY vaccines on the market. 2 are conjugate vaccines and 1 is a polysaccharide vaccine, and by preference it would be to use the conjugate vaccine for the reasons as Elizabeth showed in her very nice slides about why the immune benefits of using a conjugated vaccine. And because the other thing is the Group C component in those vaccines is felt to offer enough protection that if an adolescent had a MenACWY last year and then they're pitching up for a vaccine today in school, we wouldn't need to give them the Men C. But sometimes the school nurses are contacting practices and practices haven't recorded which vaccine it was, so we're having to vaccinate. Yes, school nurses are nodding vehemently at me about that. So that's the request. But the other thing is with this slight little increase in W135 and Y cases in the UK, as part of the public health action, contacts of cases are asked to be vaccinated against W135 or Y, and it would be the expectation that the conjugate vaccine should be used. Sometimes when I'm talking to practice nurses, they're not sure what they've got in their fridge or what they're ordering in, and some people do still have a bit of the polysaccharide knocking around. So we'd aim to go for that. Is that clear? Would you charge for public health follow-up or for travel? I think my understanding from my colleagues at the Public Health England Centre is that would be part of the global sum that's already given to GPs for kind of mopping up extra bits and pieces to do with immunisation. But if you had questions about funding, if that arose, say you had to do a lot of people, I would ask you to phone my screening and immunisation colleagues. I always like to pass it on. It's wonderful having them there. We can just go, why don't you contact the team? I was asking them for their direct phone number. Okay, what am I going to talk to you about here? Yeah, so polio is something that's been very successfully eradicated in many parts of the world. We've got 3 endemic countries left, which is Pakistan, Afghanistan and Nigeria. But what's happened in the last, what was being reported 6 months ago, was outbreaks in Syria due to the conflict going on there. And I found this lovely quote from this doctor from the WHO who'd been working in South Sudan on their polio eradication. And as soon as he heard about the polio cases in Syria, was absolutely desperate to get out there and try and help the effort. And so with polio, although it is eradicated in most parts of the world, there is a high risk of spread within that region, and if other programmes are falling over at the same time. So there are 7 countries or territories in the Eastern Mediterranean who are between them vaccinating 22 million children under the age of 5. That's quite a big catch-up programme, isn't it? But it's incredibly important. But it might be that you might not have been vaccinating travellers against polio for a while because people haven't been going places where they're at risk. But you might see advice starting to change, and there may be certain groups of travellers in whom you need to start thinking about protecting against polio. I think this is the best picture of a child being vaccinated. I think I've outdone Paula and Helen. Yeah? What's happening here? Anybody know what this is about? So this is Typhoid Haiyan in the Philippines. And one of the consequences of this was that big measles outbreaks occurred in the Philippines following that. And actually then there have been at least 10 imported cases of measles back into the UK. MMR vaccine remains and is a travel vaccine, but it doesn't appear on the drop-down lists that you get from the websites. And there is no map of the world I can pull up and go, these are the countries where you need to consider measles vaccination. But it's something we do need to have in the back of our minds. Firstly, has everybody had the doses they should have for living in the UK? And then are they doing something, or are they in a group that we want to vaccinate them because of the trip that they're undertaking? So it's just like an extra that we need to think about. But it's a really good example of how something happens in a different part of the world, and that affects how we're going to vaccinate people travelling to that country. I don't know if anybody saw the one show. I shouldn't really admit I watched one show last night. It was absolutely hideous, wasn't it, about the deaths and what was happening, how they'd all been affected. Okay, so the last thing I was just going to show you is about keeping up to date. I'd made these slides when there still was a yellow fever vaccine shortage, so I was highlighting the fact that on the NAFNAC website they did have some FAQs for healthcare professionals. But also, if you see where the orange star is, there is a system there where you can click on to get clinical updates emailed to you automatically. So a bit like with Vaccine Update, you don't have to go looking to see what's changed and what's been updated. You get it automatically. So I don't know if people get that, I get that, and I just feel that I'm just getting a bit drip-fed information, which is quite helpful. So that when something happens, I think, oh, I know about that, and I'll go and have a look on NAFNAC. Right, that was all I was going to do.